for 5 seconds or 6 seconds and do that, 10 reps. The other one was this, put your arm out straight.
Good evening. We're going to call the meeting of the McHenry County Board of Health for February 12th, 2024 to get call the meeting to order at 6:33 p.m. Start by the roll call, please.
Mr. Clark?
Here.
Ms. Gaffney?
Here.
Dr. Moyer?
Here.
Ms. Borowski?
Here.
Dr. Katz?
Here.
Ms. Ortiz? Here. Ms. Clark?
Here.
Ms. Carmen? And Dr. Ansel. And I know what else in it.
Okay. Thank you. Any public comment tonight?
No one is signed up.
Seeing none, let's move on to the next division updates and department reports. Ms. Adamson.
Thank you. Okay, so last month, you all approved the Crystal Lake renovation. Does that ring a bell?
Mm-hmm.
To do those capital improvements. Okay, so the way the process works is obviously it comes here. Then we move it through the committee on the county side. So it went to Public Health and Community Services. And a few county board members had concerns. It did ultimately move forward, but they wanted additional detail, so we provided that detail before it went to Finance and Audit Committee. So I'm bringing it up just so that you know it's probably going to get pulled at the CAL this week. We'll talk about it. Don't know if it will move forward. There is a red line version that we put together just for the architectural and engineering design services. So the way we had envisioned it, I guess, is of the remaining, I think maybe a couple months ago, I did a presentation in November to the Public Health and Community Services Committee and again to the Finance and Audit Committee that we had roughly half of the dollars had been obligated and had a plan in place, right? And then we had the other plan, but we hadn't brought resolutions. We had the other half earmarked, but we didn't have resolutions yet. So this 2.5 million capital improvement project resolution is really the idea around it, and the intent of the resolution is to fence off part of a subset of what's already fence off a portion of that 7.5, right? So that we can use it for this project. Because we still have a few other resolutions that are going to come through. You've got a few on the agenda tonight. So, but what the alternative that was presented to us is, well, couldn't we move forward with just an architectural and engineering design resolution? Because I guess sometimes that's how the county moves forward. The design and engineering resolution, or that contract, right? We have an RFP out right now for that, and Ann's going to give you more details about that. That helps further refine the project and hone in on a firm budget for the project, right? So we have a draft budget based on working with facilities of all the things that we want done. But ultimately, the architectural and engineering firm may say, you can't do that, right? It's just not physically possible, so it may change the total costs. If that happens, I will let you know. I believe it will move forward. I just don't know if it's going to move forward as fencing off this 2.5 or moving forward as the architectural and engineering portion. And then we would be bringing back a resolution for the construction piece and for actually engaging with the architectural and engineering firm. Because even though we were fencing off this money, we'd still have to bring a contract forward in the form of a resolution to provide those services, right? To enter into a contract between the county or between the Board of Health and the engineering firm, and then again, when we get to construction. Does that make sense?
Mm-hmm.
Okay. So again, Ann will update you on where we're at with that. And then just a quick update So as part of an ongoing process to evaluate our operations, we have been working with the auditor's office to review internal processes and procedures. So we did that with Veterinary Public Health Division, and we're moving forward right now with the Nursing Division and the Administration Division. So we can provide updates as we go through that, but that is moving ahead. And that is my update.
Very good. For the audio portion, Ms. Carmen has joined the meeting. Any questions? You had mentioned that it went to the Finance and Audit Committee. Did it clear that committee, or is it?
It did.
Okay.
So we had a red line version prepared for that meeting. So between Public Health and Finance, we prepared the red line version thinking they might pull it and want to use that version instead of the one we provided. Well, there was some confusion at the end. So they didn't actually pull it, and then somebody later said, oh, I thought what we were voting on was the red line version. So I'm anticipating this Thursday it will get pulled and we will have to discuss it. I was also asked to provide an email after the packet has posted. I didn't get a chance today to look whether or not the packet has posted, so I will sort of recap what I said at Finance and Audit to the full county board before the CAL, so that if they have questions, maybe some of those questions are already answered.
With the concern of doing the fenced portion of the program, does that jeopardize the funding in totality because there's an expiration date in that funding?
No, so we did talk about that back in November. Again, did a presentation at both committees, have had many conversations with county administration about our full plan, right? We were tasked with putting together a full budget plan, but not all those resolutions have come forward. So we have technically on paper earmarked the full $7.5 million. But if anything changes with this resolution, right, it's possible that we'll spend less and then we would need to come forward with another proposal. But everything is supposed to be allocated or appropriated by the end of this year and spent by 2026.
Correct. Okay.
So we're on track to do that, assuming there are no unexpected
pandemics.
Or that, you know, if the county says no to any part of it, then that would be something that is unexpected and we would have to reevaluate from there.
Thank you.
Sure.
Anybody else with questions again? Okay. Director Nolan, please.
Absolutely. I just wanted to update you on kind of where we're at for our upcoming solid waste activities for this year. So we're gonna have a alkaline battery recycling event coming up here in February. It's kind of odd timing because we had some other things going on. So it's gonna actually go from the third week of February to the third week of March, but we have done it annually for 3 or 4 years and people really like it. So we actually collect them at our counter, we recycle them and get them shipped off to the recycling center. I had mentioned a few months ago that we had worked with the neighboring solid waste agencies in Northern Illinois and also the Metropolitan Mayor's Caucus on an application for recycling education and outreach. That grant was approved. It's actually a $2 million grant over 3 years. So it involves 7 solid waste managers and departments across the region. And so we're gonna be meeting here in the next week to discuss expenditure of the individual projects. So there's about $500,000 that's going to be kind of given out to individual departments, kind of as a subcontractor type of thing for projects. So Kelly Beckman, who's our solid waste manager, she's gonna be attending those meetings and I'll bring back information when those are confirmed. We do have all of our dates for our recycling event set. We're just working on getting the locations this year, so we'll have that posted shortly on the website. And then I do think we will be hosting another household hazardous waste event on behalf of the EPA again this year. It's just delayed somewhat because this was a year where they had to go through the identifying a new vendor, and so they're working through the contract process right now. But I do anticipate that we will have one again in a year, which has been very well attended the past 3 years. So that's all I have.
Any questions? Thank you. Director Karras?
So respiratory illness, RSV is low, COVID is low, but influenza is in that moderate range, and overall respiratory is in the moderate range. So we're, stable, nothing that's not out of the ordinary for this time of year for us. We are finalizing the rabies training, the cross-divisional. We're all working together on that. That is next Wednesday, so that is being finalized. Next Friday, the 23rd, is also our annual school nurse conference that we're doing, and Dr. Katz will be one of our speakers. So the agenda looks exciting, and we're starting to get people registered for that. We'll be talking about this later in the agenda about our mobile clinic. We do have an RN that is getting her MPH through Northeastern Illinois University, and she will be helping us with that project, so that we're happy to have her on board to do that as our capstone, because it is a big project. So I'm sure you'll be kind of seeing her as we move that project along and giving updates.
Any questions from the board? Thank you. Director Howell?
There's a few updates for you. You remember that we agreed upon the contract for Dr. Peterson back in the fall. We've had a hiccup with the liability portion of that contract, and right now we're still trying to work it out. Doesn't look like we're going to bring Dr. Peterson on right now. She had done a couple of clinics for us just on the side, but I'll keep you posted as we work through that. We have one animal control officer position left. As you know, our ACOs work both in the field and then rotate in the kennel. Between adoptions and intake of animals, surgeries, etc., we find ourselves with a little bit of a hole in there. So we'd like to take the last ACO position and look towards the office and kennel as opposed to the field and kennel. Right now, we're pretty good. We've got our 9 field people in. We don't feel like we need that position in the field right now. We really need it in the office. We have a lot of new people in the office. As you know, last year we struggled a little bit with some of our tag packets. So I've been working with Melissa on transitioning that position and bringing forward a job description for that position and bringing it to HR. So I'll let you know next month once we get it passed through HR. The National Animal Control Association is holding a national state summit in May, and I've been asked to represent the state of Illinois at that summit for the Illinois Animal Control Association. So I'm excited about that. I'm very curious. It's called The Future of Animal Control. So we'll see what that entails. And then also the Welfare Act, the Animal Welfare Act, they're looking at making some changes with that here in our state. And I've been asked to represent our organization with IDOA. So most of it doesn't necessarily pertain to animal control, but it pertains to shelters. So I'd like to be part of that conversation, make sure that our voice is being heard. I'm also going to be working with the Illinois Animal Federation, bringing their voice up to that association as well. So we'll see how that transpires in the next few months. And then you might recall the conversations in the news last year about xylazine. So there are about 3 or 4 House bills, Senate bills talking about xylazine. If you do not know, xylazine is used in our clinic. It's used in all animal controls, vets' offices. So there's a lot of concern about changing that over to a controlled substance, 2 or 3 or whatever. So we're kind of watching that because that's used for any sedations, for animal comfort rooms, for surgeries, for an animal that's injured that comes in our facility before it goes over to the emergency hospital. So we really don't want our ability to utilize that tranq taken away. So we're just kind of watching that, making sure our voice is heard again with our lobbyists. So Illinois Animal Control Association has a lobbyist that we work with. she follows all the different bills that they're looking at.
Does that mean that if it were a scheduled drug, you couldn't have it in the clinic? Is that what you mean?
Well, we would be able to have it, but it have a lot more parameters around it, just like youth assault does. It might call for other trainings. We already follow our xylazine, the same process as we do our controlled substances. But if you look at animal control as a whole over our state, different organizations don't have the same parameters as we do around our controlled substances. So we want to make sure that people are able to use it for that trank, that you might need to trank an animal to take a look at it, right? But also make sure people are following whatever the rules are.
But you would still have it in the clinic?
I believe it would not affect us having it. Now, what we might have to go through to maintain that will probably change for us. I can't speak for the other rescues and animal controls, because right now in those bills, they're not giving an exception to euthanasia technicians, and we're trying to move that in there because they do have some exceptions for veterinary clinics, and we want the same exceptions we use for youth assault to be looked for xylazine.
Is that just to limit the amount of people who have access to it?
Yes, yeah. And we have a very secure process in what we
I know,
do.
but the health department isn't like selling it on the street.
Well,
But I mean,
But
horse
somebody might be
horse
that
people
way.
use it all the time.
yeah, it shouldn't be it should be, people should be very, very aware of it because it's a killer.
Yes, yes.
You know, so I mean, that's the issue with it is.
But we want to make sure that the guidelines are fair across the board and not.
We want to make sure that everybody is able to follow all the parameters that we put on it, so that we have a system in place. If it suddenly changes, we have a system in place on how we'll be able to get it, keep it, use it, report it.
You think it's going to be, the way it's set now, it's more stringent than Fatal Plus?
Xylazine is not more stringent than Fatal
No,
Plus.
if what they're proposing will be, right?
Yes, yes.
Which doesn't make any sense to me.
It'd be a higher cost.
Xylazine is used
the other
over the,
euthanasia
or,
Is it administered under the license of our,
people that
Yes.
use the euthanasia drugs for,
We also
For
have an agency
having put out
license
their
though too. We have a
that's
we
why.
have
That's
an
true. No, but I'm
agency
saying if they
license,
made
and then we
it
have a
as
controlled substance
stringent as
license with
Fatal
our
Plus, it'd be
state
fine.
and the
But if
feds.
they make it more stringent than Fatal Plus, that would be more difficult.
thank you.
Because I mean, Schedule
It's
2,
really,
Schedule 2, Fatal Plus?
yeah. Yeah, and it's.
So I just wanted you to be aware of it because it is
It's a deadly
conversation. And it's right now being proposed in about 3 or 4 bills.
Yeah, I don't have any problem with the control over it. I don't use it.
That's all I have.
Any questions from the board? Thank you.
I'm sorry. Do you know any animal shelters that are part of the,
Federation? Yes.
that are going, from Illinois, that are going?
They're going to that,
The summit?
no, it's only animal controls.
No, the second one. Well, it wasn't a summit. What was the other?
Oh, that's when we're going to talk to the Illinois Department of Ag.
Right,
I am working with the president of the Federation.
okay. But I mean, are other shelters, animal shelters going to participate in that, or is that just a one-on-one conversation?
It's a one-on-one
Got it,
conversation.
thanks.
Thank you. Director Marin?
Thank you. As Administrator Adamson alluded to, we did go out for an RFQ in January for the Crystal Lake facility. We actually received 11 submittals last week, and we're able to go through them. We were very excited about getting 11 submittals from engineering and architecture firms. So we each went off on our own and ranked them on our own, and last week the review committee met, and we were pretty on top of it and in agreement on our top 4. So we came to them with the top 4, and we were able to narrow that down to 2 finalists. So we are meeting with the finalists tomorrow to interview them, ask them lots of questions, and we hope to determine, who we would, move forward with for doing a walkthrough of Crystal Lake, because right now, and what I think a lot of people don't understand is it's 2.4 million, but it's a conceptual kind of project right now, because we don't know with the age of that building, what is needed, what we are gonna be able to do and what we aren't gonna be able to do. So we kind of put all the things we definitely want. And it's very exciting because I think it would just, you know, increase our accessibility, make more room for everybody, safety and security. So we'll walk them through and let them see what our vision is. And then they would come back to us with a proposal for architecture and engineering services. Meanwhile, back at the ranch, you know, the county will be moving all of this forward. So the committee of the whole will have met and, you know, the county board meeting. We'll know a little better where we are, hopefully have some better numbers together that we can present. So we are very excited to move forward with the project and look forward to meeting them tomorrow. And that's all I have.
Any questions from the board? Thank you. Manager Dietz.
Just a couple things. So budget-wise, we are just a little above on our revenue where we should be 2 months in. So 16.94 versus 16.66. And then on the expenditure side, we are a little lower. We're a couple percent lower, so we're doing very well on maintaining and watching our expenses and so that we're on track for the year. We are also working on policy review for DHS and IDPH grant requirements. They're getting, I guess, more strict on what they're looking at. So we just went through an audit, which will come up next month. But just reviewing all the policies and procedures. It's not just at the health department level, it's also at the county level that we have to make sure that we have these in place to be able to continue to get the grants. So I'm working on that also. So that's all I have.
Any questions from the board? Thank you. Next item on the agenda is the consent agenda. Dr. Amsler is absent today. Is there a board member that wants to be recognized for the consent agenda?
Sure.
I started to, and I
Sure.
Ms. Carmen?
I make a motion to approve the consent agenda.
second.
Ms. Carmen?
Motion has been made by Ms. Carmen, second by Ms. Gaffney to approve the consent agenda. As it involves monetary expense, it'll be a roll call, please.
Ms. Carmen?
Yes.
Ms. Gaffney?
Yes.
Mr. Clark?
Yes.
Dr. McGuire?
Yes.
Ms. Morowski?
Yes.
Ms. Ortiz?
Yes.
Ms. Clark?
Yes.
Dr. Katz?
Yes.
The majority voted in favor, the motion carries. Next item on the agenda is item 5, contracts and agreements. 5A, regarding the Northern Illinois University MPH agreement. Does a board member wish to be recognized?
I'll make a motion to approve the item regarding Northern Illinois University MPH agreement.
Second?
Who's Cindy, you second it? Thank you. Does anybody from staff want to make a comment on it, please?
Yeah, I just want to make a correction. The agenda, it's Northeastern Illinois University, not Northern Illinois.
It's correct, and so what's in the packet is correct.
The agenda.
Does that require a new motion?
Yeah.
I don't think
Okay.
No. Okay. So we have a motion on the table to approve the contract with Northeastern Illinois University MPH agreement. The motion was made by Dr. McGuire, seconded by Ms. Gaffney. Yeah. Is there a monetary value to this contract? No. As such, it'll be a voice vote. All those in favor, say aye.
Aye.
Those opposed, say nay. Ayes have it, motion carries. Next item is item 6, new and unfinished business. 6A, resolution authorizing emergency appropriations of ARPA funds to purchase and operate a mobile clinic for the Department of Health. Is there staff that wants to do an introduction on that?
So this is our plan to, use the ARPA funds. It's for mobile clinic, and then it's a 33-foot RV is what we're asking for. It'll have a counseling room in it, and an exam room, and like a check-in area. We will be using it for WIC, starting out, and then hopefully, that'll be our first program that we kind of start with, and then move into immunizations and possibly some, school physicals and things like that, that we're already in conversation with partners in the community on doing that. So this is a very exciting project. A lot of moving parts that we're trying to make sure we have all the logistics in place. So this is where the student's going to be, I think, a huge help for us to get that going.
Thank you for your work on that. I think that's huge for the community.
Does the board member want to be recognized to?
I had one question. I had one question. Where will you store it?
Yeah, we've had conversations with the Sheriff's Department because they control the parking lot. And out in front of the corrections facility are areas where they used to park the large buses. And we are going to be able to park it out there. That is the plan at this time.
I just worry about vandalism, that's all.
Well, hopefully right in front of the jail.
You'd think. You'd think. I'm just saying.
You never know, but.
There won't be, I know there was questions about what we would be storing in it, like syringes and things. It's going to be pack and go, and then, unload. So nothing will be stored in there of interest. Not to say anybody wouldn't break in and find out there's really nothing in there, but there will be no storage in there, items like that.
Cool. And it has the ability for the vaccine temp control things.
Yeah, well, we already have the CDC approved portable units, which we will just load in there when we go. And unload when we get back.
Okay, cool.
Is there, I know that I've looked at the floor layout, and I think it looks right. Is there think there's a flow pattern for that? Are they gonna go in and go out the same door? You don't anticipate like tons of people trying to get in and get out?
No, we'd have to space it out,
Okay.
for timing. There's not a whole lot of room for people to be sitting. It's not like a waiting room inside. There's probably gonna be like 4 chairs that we could use.
Like the blood donation units.
Yeah, very much like that.
It would require obviously a driver, right? Like can't even think about it.
CDL driver.
Yeah, a CDL
Well,
driver.
it's not a CDL, it's a Class C driver, so it's like, I guess not like below the CDL. I don't know how that all rates.
Like an in
but
between.
yes, because, so we are looking into how do we contract with like a tow. I mean, they're all CDL. I know other counties, we've talked to them on what they're doing, and they're contracting out to like schools and like towing companies to have drivers.
I'm retired now, I can.
Well, and we've talked about the MRC and trying to get individuals like a crew there to commit to that as well. So those are all, it's a great question, and we're looking into that.
Would the Department of Transportation be helpful?
Well, yes, we haven't had that conversation with them yet, but even the Sheriff's Department, we were thinking about kind of going back to them too, because who is driving those large transport vehicles? And who did they use? And is it internal staff? So those conversations are ongoing.
I'm going to ask for a board member to make a motion on this issue.
I move that.
Just a second. I would suggest that in addition to the wording that's on the agenda, that you finish the sentence and refer the the issue to the county board for their consideration. Because that's ultimately what we're doing. We're approving it here and then we're referring it to the county board. Correct?
Well, that is true, but I don't think you have to put, because it's automatically going to happen.
Okay.
So, I mean, I don't object to you put, but I can't change, I'll have to get somebody to change this title, because it's already, once it goes into eScribe like this, then we direct it where it needs to go. So from here, it's gonna go to Public Health and Community Services, then it'll go to Finance and Audit, then it'll go to Cal, then it'll go to County. So it
Okay.
automatically happens
For
With
resolution.
that information.
with the resolution the way it is.
Yeah.
I withdraw my comment. Just go with what's identified in the agenda. And Cindy?
I would like to make a resolution authorizing the emergency appropriation of ARPA funds to purchase and operate a mobile clinic for the Department of Health.
I support it.
A motion has been made by Ms. Gaffney to approve the resolution authorizing an emergency appropriation of ARPA funds to purchase and operate a mobile clinic for the Department of Health. It's been seconded by Ms. Clark. Roll call vote, please.
Ms. Gaffney?
Yes.
Ms. Clark?
Yes.
Dr. Katz?
Yes.
Ms. Ortiz?
Yes.
Ms. Morowski?
Yes.
Dr. McGuire?
Yes.
And Mr. Cook?
Yes.
And Cecilia Carmen, yes.
Oh, Cecilia Carmen, sorry.
Okay, that's okay.
The majority voted in favor, the motion passes. Thank you. Next item is item 6B. Would a staff member care to comment on 6B?
You want me to do it? I can do it.
That's fine.
Okay, so this is in conjunction with last month. We brought you the, I think it was last month, MAP community grants. And so those are going to be those external grants with community members that we're getting ready to launch and announce. This is to pay Bronner, that's the consulting firm. The county had contracted with them, has contracted, is in a contract with them to manage their ARPA funds. This is additional dollars for them to help us manage this particular process because they're going to have to review the grants, score them, recommend them, make sure that they meet all of the ARPA eligibility. So we have to pay for that out of our portion for this purpose.
Okay.
Does anybody have questions about that?
Is this like mandated, like we have to have a consulting firm do this? Or is this-
I
is
am
this
not gonna
just-
say that it's mandated, but I will say it is highly encouraged because I don't think the county is going to move forward. They would think it was too risky, is my guess. So by having Bronner review it, that lowers the county's risk. Because at the end of all of this ARPA, if for some reason any county moves forward with an ARPA expense that ultimately does not meet the eligibility, it's audited later, then the county is going to have to pay back those funds.
Okay,
Oh.
all right,
So it's sort of like a risk management component.
all right.
And we're not the experts in determining, I mean, we have a good sense, I think, of what is eligible, but they are the experts in checking the boxes and making sure that the projects, and in this case, the individual community grants meet the eligibility.
Okay, makes sense. It's like insurance.
Mr. Chairman, I'd like to make a resolution authorizing the emergency appropriation of the American Rescue Plan Act for funds consulting services to manage community health initiative grant funds for the Department of Health.
Is there a second?
I'll second.
Motion is made by Ms. Gaffney to approve the item in agenda item 6B. It's been seconded by Ms. Morowski. As it is a monetary issue, we'll do a roll call vote, please.
Ms. Gaffney?
Yes.
Ms. Morowski?
Yes.
Ms. Carmen?
Yes.
Dr. McGuire?
Yes.
Ms. Ortiz?
Yes.
Dr. Katz?
Yes.
Ms. Clark?
Yes.
Mr. Cook?
Yes. Majority voted in favor. The motion carries. Item 6C. Is there a staff member that would like to?
Okay, so I'll take this one too. So again, this is something when the county did their Advanced McHenry County and did similar community grants, they used Neighborly to manage the reporting process and the reimbursement process. So that's where grantees are gonna go in, they're going to submit their reports and request for reimbursement. So our staff, it's a license for that. They will go in and make sure that they've met their deliverables before there's a release of the funds.
Board member, make a motion?
Yeah, I'll move to approve the resolution authorizing the emergency appropriation of ARPA for funds to purchase a license for Neighborly for the Department of Health.
And a second?
A second.
We have a motion made by Ms. Borowski, seconded by Ms. Ortiz, to approve the resolution authorizing the emergency appropriation of Rescue Plan Act of 2021 ARPA funds to purchase a license for Neighborly for the Department of Health. As it is a purchase of a license, I ask for a roll call vote, please.
Ms. Morosky?
Yes.
Ms. Ortiz?
Yes.
Dr. McGuire?
Yes.
Dr. Katz?
Yes.
Ms. Clark?
Yes.
Ms. Carmen?
Yes.
Ms. Gaffney?
Yes.
Mr. Clark?
Yes. Is the majority voted in favor, the motion carries. Next item on the agenda is board issues. Any board member have an issue they wish to bring up and discuss? Hearing and seeing none, we'll move on. Next item is information and communications. The staff, anybody on staff want to make a comment on this?
This is our audit for WIC, as far as our deliverables on the grant. We met all the standards, we did, and this isn't unusual, I'm not making excuses, but our caseload was below what, the limit of the benchmark that they wanted. We did have staff turnover. Breastfeeding duration numbers were lower than the benchmark that was set for us. So we had to provide what we're moving forward to try to improve that caseload. So a lot more outreach is going to be done. We're going to be trying to partner with individuals. And I think now the mobile clinic, we may not see that this year, but the mobile clinic from other counties that are using it, they have definitely increased their caseload in WIC in particular by using their mobile units. So hopefully that will help us with those numbers moving forward once we have that on.
How long is the time period for the audit? Is it like a 2 year, over the last 2 years, the last?
They look at the previous year.
Oh, okay, okay.
Any other questions from board members in regards to the report? No actions required, correct?
Correct.
Okay. Thank you for providing that information to us. There is no need to go in executive session. You have in your packet the appendixes for you to review. And the next item is adjournment. Anybody want to make a motion to adjourn?
I make a motion to adjourn the meeting.
And a second?
Second.
Motion's been made by Ms. Clark, seconded by Ms. Carmen to adjourn the meeting. All those in favor say aye.
Aye.
Those opposed say nay. I have it. We are adjourned.
You shouldn't be doing that, the camera's right there looking at me.